Good morning. Thank you for joining us. At the City of Frederick, we believe in a simple but powerful value that every resident deserves access to care, dignity, and the ability to live a healthy life. We know that when families are healthy, when seniors are supported, and when children can grow up strong, our whole community is stronger. But none of this work happens alone. Frederick succeeds when we work together, city and county governments, our hospital and health providers, our nonprofit community, and our residents. Partnerships are the way we solve big challenges, and they are the way that we will meet this one. That's why we're here today. We, in partnership with Frederick County and Frederick Health, are announcing the creation of the Partners for Accessible Care and Treatment Task Force, or PACT. We call it PACT because a pact is a promise. And this task force represents our promise to stand together to protect access to care for our residents and support our healthcare systems as they endeavor to meet the need. Medicaid was meant to be a promise too, that if you're struggling, if you're aging, if you're raising a family on the margins, you would still have a pathway to care. But the legislation known as H.R. 1, or the One Big Beautiful Bill, threatens to dismantle health care as we know it by cutting more than $1 trillion from Medicaid. It strips funding from food and housing programs that directly affect health outcomes. And it passes the responsibility for care down to states, counties, and cities without giving us the resources to meet that need. Here in Frederick, we see the effects that would have. More people losing coverage, more families left without options, and more pressure on a healthcare system that is already stretched thin. We know we can't wait for these consequences to arrive 2 years from now, as they are scheduled. That's why we are launching this task force now. The goal: develop strategies to keep people enrolled in Medicaid as long as possible. Push for state-level protections and funding while building a federal advocacy strategy to restore these important resources. And planning for long-term stability so that our healthcare providers are not overwhelmed and our residents don't lose critical services. We expect this task force to provide a comprehensive list of recommendations and a federal and state advocacy strategy by the end of this fiscal year. The challenges ahead are serious, but so is our commitment. Frederick will not turn away from this responsibility. Through partnership, preparation, and persistence, we will protect access to care for the people who call this community home. This task force represents the best of Frederick: government, healthcare, and community partners stepping up together to protect our neighbors. And I'm grateful to be joined by a wonderful partner in much of the work that we do in the city of Frederick. Our county and Frederick Health are both here today as well. And it is my honor to introduce our county executive, Jessica Fitzwater.
Thank you very much, Mayor O'Connor, and thank you also to Dr. Chaffee and your team and all of our community partners for coming together to address this important issue. The changes Congress made will affect everyone in Frederick County, from our major employers and major institutions like Frederick Health down to our Alice families and the most vulnerable people in our community. In Frederick County, when we're confronted with a challenge like this, we come together, do our best to understand what it means for the people we serve, and have honest conversations about the best path forward for our community. That's just the Frederick County way. We know Frederick County is home to more than 48,000 Medicaid enrollees, many of whom live in rural areas where access to care is already challenging, who will feel the most significant impacts late next year. Others in our community are feeling significant impacts now. For example, the federal government eliminated the SNAP education program, which provided direct nutritional support and education to more than 8,000 residents, many of whom are students in our community schools. Through the Partners for Accessible Care and Treatment Task Force, we plan to come together to quantify the impact of the federal actions on our community and develop a coordinated regional response. I am so proud to stand alongside our great partners, the City of Frederick, Frederick Health, and all of the nonprofit and community organizations who are here with us today and who are out in our community every day, meeting people where they are and helping to move our community forward. We will not be able to undo what the President and Congress have done. We will not be able to restore funding to every program that will be effective. But what we will do is coordinate and collaborate to develop a plan that mitigates the worst impacts on our communities and creates a shared agenda for us to advocate with policymakers. Now, I would like to turn the microphone over to Dr. Cheryl Chaffee, President and CEO of Frederick Health, who can address this issue from a clinical perspective.
Thank you, County Executive Fitzwater. Frederick Health is the only hospital in Frederick County. We serve everyone from city neighborhoods to our most rural zip codes. Like many hospitals across the country, we are vulnerable to cuts coming from legislation, tariffs, cuts in Medicare and Medicaid, closures, and reduction in services by community nonprofits. If these cuts move forward, we could be forced to stop our capital investments that are designed to increase the number of patients we can serve, curtail our population health efforts that are designed to keep people out of the hospital, and support some medical specialties, forcing people to travel out of the region for care. That's why Frederick Health is proud to support the launch of the PACT Task Force. This data-driven, collaborative initiative will help us to monitor trends in coverage and access, share information across our partners, and ensure that we are collectively responsive to community needs as they evolve. We're committed to this task force because we are our community's healthcare system, and your healthcare is our #1 priority. This response requires coordination to keep data flowing, to elevate needs quickly, and to protect access to care and fulfill Frederick Health's mission, which is to positively impact the well-being of every individual in our community. Thank you.
Thank you, Dr. Chaffee. Before we close, I want to take a moment to thank all the partners who are here today. The work you do every day for our residents, providing care, offering support, and building healthier communities is the foundation that makes Frederick stronger. This task force will only succeed because of your dedication and your expertise. I also want to extend a special thank you to Representative Karen Hendrick from Senator Chris Van Hollen's office. Senator Van Hollen has been a steadfast advocate for protecting Medicaid funding, and we are grateful for the support and partnership his office continues to provide in this effort. As for what comes next, in October, this group of organizations will be convening an event to bring together federal, state, and local representatives to have a focused conversation about the impacts of these proposed cuts. At that event, we will also break into working groups to brainstorm strategies necessary for advocacy and program design. Those conversations will directly guide the priorities and the actions of the PACT Task Force moving forward. Today is the start of that work. It's not the end. The steps we take together in the months ahead will shape how Frederick protects access to care for our residents. So once again, thank you to everyone who is committing time, energy, and expertise to this effort. Thank you for showing up, for standing with us, and for being part of the promise we are making to our community. Thank you.